My name is Dr. Grant, and what we're going to do today is we're going to go over shockwave therapy for plantar fasciitis. So what we're dealing with today is we're kind of dealing with the patient that's been dealing with a little bit of heel pain for a while, and so she just kind of wanted to see what it feels like today. So we're just going to run through a diagnostic session with her, and what we're going to do is we're just going to kind of work through the area, determine if the plantar fascia is the actual cause of the pain or if there's something else that we need to address at this time. So what we're gonna do today is, I already have her kind of cleaned off. What this is this is our shockwave machine. So it is a focused shockwave. And what we are going to do is we are gonna start off here with a diagnostic session where we are going to kind of check different areas of the foot. We're gonna start kind of up into the ankle here, work our way down into the foot to really find and hone in on the specific spot that's causing her a lot of pain. So why we're doing shockwave is it's a very good tool to be able to find and pinpoint where the pain generator is coming from. So how it does it is it uses acoustic shock waves that are going to kind of penetrate into the skin, find kind of the painful or injured tissues, and then really focus in on trying to clean it up, allow it to kind of heal a little better, and then overall feel better. So we're gonna start off here by applying a little bit of ultrasound gel to the bottom of her foot, and all of the areas that we are going to cover in the two areas that we're gonna start off with. So how my settings are going to start is we're going to start off on a very low intensity just so she can feel what it feels like. So we're not really causing pain on the first day or trying to at least initiate that pain response. We're just trying to get her to feel what it feels like as well as pinpoint the area that's causing her pain. So how we're gonna approach this is I'm gonna kind of just spread this ultrasound gel around a little bit, kind of cover the surfaces that we're going to work on. Her do is, as I'm kind of working through and checking on these different areas as I go through a scan, I'm going to be asking her, hey, how do you feel? What are we feeling in this position? Does it feel like it's causing pain? Is it reproducing the same symptoms that you came in with? Okay, so are you ready?
I'm ready.
All right, so we're going to start off here just in the calf, and then all we'll hear is that little click, and then all I'm gonna do is just move around a little bit. And so it sounds like we may have found a spot. What do we feel?
Some discomfort, like almost like a stinging sensation.
Stinging, okay. Is that what you came in with?
No.
So we'll kind of keep moving through here. Same thing, what do we feel?
A little discomfort right there.
Okay.
Not producing the same symptoms though.
Okay. Then we will just kind of keep moving on. What do we feel?
A little discomfort.
Same thing?
Yeah.
That's pretty tender.
Yes. That's starting to create some of the similar symptoms.
Okay. So now that we have a specific spot, we're gonna go off of it just to kind of get a little bit of relief. This feels okay?
No.
Okay, so moving through here, not really experiencing much of anything.
There's some discomfort right there.
Right through here?
Yes.
Okay. So now there's a specific spot that we found. So what we're gonna do is we're just gonna kind of focus in on that a little bit more. And all I'm gonna do is I'm gonna kind of move my hand around, changing the angle. Let me know if any position is worse or better. How do you feel here?
Better.
Good. And then compare it to here.
Better.
Good. And then when you point it towards the heel.
Oh, worse.
Right there. Okay. So right now we're gonna leave it here for a few seconds, let her get used to it, and then we're just gonna move off of it again. Better?
Yes.
Okay. And now we're gonna go back to that spot. Let me know. Right about here.
No. No.
Do I need to go
There.
right there? Okay. Same thing here for about 5 seconds, just so she can kind of get used to it. And then we're gonna move off again. Continue our scan a little bit more. And finding our spot again, let me know where we
There.
are. Right there. Holding it again, 5 seconds. And then we're back off. Okay, so what we discovered is we found one specific spot that is reproducing her pain, that is kind of what's causing most of her issues right now. So what we need to do moving forward is this is going to be our main focal area. Our goal is to increase the intensity with the shockwave so she can get used to the feeling and also be able to do the activity that she's doing on a regular basis so she can get back to what she enjoys doing. So that is all we were going to do today. You can go ahead and just relax and we will call it a day.